How do eligible clinicians participate in the merit-based incentive payment system? I'm Molly MacHarris with CCSQ, and I will be leading you through this discussion. So, how can clinicians actually participate in the merit-based incentive payment system, or MIPS program? For the first year of 2017, there is the ability for clinicians to pick their pace. So what does pick your pace mean? Pick your pace is the ability for clinicians that have varying levels of readiness for participation to participate in the program. As you'll note on the slide here, there are 4 options for participation. The first deals with participation in an advanced APM. For more information on how to participate in the quality payment program under an advanced APM, please refer to other training modules where we go into that in more detail. For the remaining Pick Your Pace options, you'll note that those 3 remaining options all fall under the Merit-Based Incentive Payment System, or MIPS program, and they include a test pace, a partial pace, and a full year pace. Before clinicians determine how they should participate, they should assess their readiness, and they should make a determination based off of their readiness on how fully they want to participate. One additional thing I want to note is that clinicians who are eligible to participate but do not, they would receive an automatic negative 4% adjustment on their claims in 2019. We do not want this to happen. We want as many clinicians who are eligible and able to participate in the quality payment program to do so. So I will talk through these Pick Your Pace options in a little bit more detail to describe how clinicians can participate. So the first option deals with the test participation. The test participation option allows clinicians to participate minimally in the program and still avoid a negative payment adjustment. So what is considered a minimum amount of data? A minimum amount of data could include something as minimal as 1 quality measure for 1 patient, 1 improvement activity, or the base elements of the advancing care information performance category. You'll note on the slide here that under the advancing care information performance category, it says 4 or 5 required measures, and the difference on whether it's 4 measures or 5 measures will depend upon your addition of certified EHR technology you have available to you. But to summarize the test option, any clinicians who participate under one of these things would be able to receive a neutral payment adjustment under MIPS and avoid the negative payment adjustment. So the partial participation option. For clinicians who want to participate partially in the quality payment program, this may be clinicians who have participated in one of the programs that are sunsetting, but maybe they haven't had the full experience and they're not ready to participate in a full manner. So the partial participation option would be, in the majority of instances, clinicians who participate for a 90-day period. The last full 90-day period that's available under calendar year 2017 would begin on October 2nd. And this partial participation could be any 90-day period for any of the performance categories, or it could be a 90-day period for one of the performance categories, or a longer period for any of the performance categories. And then on the next slide, we talk about the full participation option. So the full participation option would really be for those clinicians who have participated in the programs previously. They are ready to begin on January 1st, and they want to really try to maximize their incentives. These clinicians would be able to participate for the full year, the full calendar year of 2017, for all of the performance categories, or again, it could just be for a partial performance category. We have received a few questions on exactly how the Pick Your Pace works and whether clinicians have to register to let us, CMS, know on which option they want to choose. So let me address those questions. 1, Clinicians do not need to register or tell us, CMS, exactly which pick your pace option you are choosing. We would just encourage you to start submitting your data, and we will be able to make the determination based off of the data we receive on how you participated. We've also received a few questions on if a clinician wants to participate longer than 90 days, but they don't think they would be able to do the full year. Is that acceptable? And the answer to that is yes, that is acceptable. We would really encourage clinicians to participate as fully as possible. If they can do it for the full year, that's great. If they can't, we would encourage them to do it as long as they can. If it's longer than 90 days, if it's 6 months, 9 months, whatever it is, we would really encourage everyone to participate as fully as they can. And so just to wrap up some of the pieces I was going through on the previous slides, so the bonus payments and the performance periods, again, these are really flexible options that we have available for clinicians. Clinicians should pick the options that are best for their practice. Additionally, under the MIPS program, we have options whereby clinicians can participate either as an individual or as part of a group. And this is an important choice that practices should make, because if you participate as an individual or as a group, this will differ on the submission mechanisms that are available to you. So individual assessment is applied at the unique TIN, the tax identification number, or the unique NPI, the National Provider Identifier level. And then the group options deal with 2 or more NPIs who have reassigned their billing rights over to the TIN. We also do have a group option for APM participation. Thank you for viewing this presentation. For more information, please visit the Quality Payment Program website at qpp.cms.gov.